Welcome to another episode of our TSG podcast. Thank you for tuning in. For this episode, I have two of our TSG coaches with us, so you guys get a little 2-for-1. I have Emily and Dom with us. Thank you for joining us.
Yeah, thanks for having us.
Yeah, I'm super excited to chat and have some good conversation.
It should definitely be a fun conversation about a different topic. A lot of people, when it comes to powerlifting, maybe talk about technique, or maybe talk about programming, or maybe even like attempt selection, but not many people talk about other aspects of the sport, like maybe nutrition, maybe sports psychology, or in this case, like injury management. So it should be a fun discussion when it comes to injury management. And what I want to first start off with is, because people maybe don't know both of you, is if you want to give a little background first of, what you studied in school and what kind of certifications you have. And then if you want to even go into how you got into powerlifting.
Yeah. So both of us are physical therapists by trade. So we went to Slippery Rock University in Pennsylvania. Emily was the year below me in school. We met there, started dating there as well, and ended up graduating, becoming PTs and out of school. Went through the NSCA, got our CSCS, our CPSS. So getting a little bit more into the strength and conditioning side as well as our PT practice. And then just some continuing ed since then, got involved with TSG and trying to grow as we keep going.
Yeah, I did end up marrying my teacher, I guess you a little bit. But yeah, so actually, I think I got into powerlifting first, which is funny because every time someone meets us, they're always like, "Oh, Dom got you into lifting." And I'm like, actually, no, I didn't. So I played softball in college and we had to lift for some of that. But after that was over, I knew I needed to keep exercising, but I hated running. That was like not something I wanted to do. And all I knew was the weight room. And so I just kept staying at it, kind of like bodybuilding style, college girl workouts. And then I had a friend that competed in powerlifting and I thought she was just amazing. And she said, "You're pretty strong. Like you could do this." And I was like, "I don't know. I only weigh like 50 kilos. Like, that doesn't make any sense." But then she got me into it and I've been hooked ever since. I think that was like almost 10 years ago at this point. And so I had to teach Dom how to deadlift when we met. And but yeah, we got super lucky knowing really great athletes to get involved with TSG. And it's definitely been the highlight of my career for sure.
That's interesting. Whenever I talk to someone about powerlifting, they may say like, "Oh, well, you don't look like a powerlifter," or they may be like, "Oh, I can never do that because I'm this body weight or I'm this age." And I have to explain to them that we're one of the sports where, like, regardless of what body weight you are, regardless of what age you are, you can actually compete because of the category for you.
Right. Yeah, exactly. Like you need the small powerlifters too.
Yeah. So how much did you have to convince Dom to do a powerlifting competition? Was he like, "All right, sure, let's do it," or was he fighting you on it?
Well, it was actually funny because you're in PT school, you learn about so many injuries and you learn about all of these risk factors and things that can hurt you. So for me, deadlifting was going to be a culprit for so many back injuries and herniated discs. And so when we met, she was a heavy lifter and I was like, "You're out of your mind. Like, I'm not going to blow a disc out."
He was like, "I don't squat more than 225 ever."
And so I don't know. Emily kind of helped mold our practice because she showed me different lifts and different studies. There are no studies showing that deadlifting causes herniated discs. So after that, it was pretty quick to convince me because, I don't know, I'm short and stocky and I don't have to move a bar very far. So I ended up being pretty decent.
Nice. And I was going to quickly ask you as well before we get into the injury management stuff, is because you guys had mentioned you are certified strength and conditioning coaches, is if you want to quickly talk about maybe why did you decide to do that, and have you seen any benefits to that certification? Because people are always wondering, should I do one of these like certifications or is it not really worth it?
Yeah, I can talk on my behalf, and then Emily's is going to be a little bit different because Emily's in a bit of a hybrid role where she does physio, but she also does some coaching and strength and conditioning on the side. For me, I did it from more of a rehab perspective. Therapeutic exercise selection in PT is a little bit overlooked in PT school. You're very good at diagnostic skills. You're very good at screening out other pathologies. But when it comes to what do I actually give a patient to do exercise wise, it's something that gets overlooked. And that's why a lot of people that we work with through TSG, when they see in-person physio, they're doing these really, really basic exercises that are not going to load their tissues to tolerance. So for me, I recognized that and I wanted to get additional certifications to help me with my exercise selection, even though I don't do a lot of just straight strength and conditioning.
Yeah, and I actually struggled a lot picking between going into strength and conditioning or going into physical therapy, because I knew I loved exercise, but I knew that strength and conditioning wasn't going to monetarily be a great career. And so I was like, well, let me try to do PT school. And I had the same experience where like everyone thought I was crazy because I wanted to squat with my patients. I didn't want to just like sit on a table. And I was like, I can't do this. Like this, I'm not passionate about just like giving band exercises, you know? So I got the CSCS to possibly go into strength and conditioning. But now I feel like with working with elite athletes, like I need more of the strength and conditioning than I do the actual PT stuff in a way, because I have to know how to get these people back to sport. So I think that we got it as like a avenue to explore, like, do we enjoy this side of science and of exercise? But I don't know if it necessarily would benefit us in the real physical therapy world, where like if we had a traditional PT job, I don't think anyone would care, really.
Got it. But yeah, it might give you additional knowledge, like you said, in order to perform your job, because, you know, and something we'll probably talk about is like you'll get those physical therapists or doctors just tell you like, don't lift, don't do anything. And that's the way they want you to recover, versus you can come in and say, hey, I have knowledge in this area. I can then show you how to be able to lift and navigate around the injury. So you kind of get that benefit. The other thing I've heard, and you guys can tell me what your experience is, that I've heard the CSCS is quite a difficult exam compared to like just a general certified personal training certification, especially ones that you can just like do online on your own. So did you find that exam to be difficult or kind of easy for you?
Well, a lot of the basic science and foundational stuff for nutrition and requirements for building muscle, you learn that in PT school and undergrad. So we certainly had an advantage going into it with that knowledge. But then the more applied section, where you're actually looking at videos of exercises and trying to critique form, that tends to trip people up. Like when I have PT students at the university that I work at that go to take the CSCS and they think they're ready for it just because they're in the program. And that section tends to trip them up, where you have to be a little bit more experienced as a coach. So certainly I would say it was harder, or is harder than the CPT, but I don't think it's something that is overly challenging for somebody that's in the gym critiquing their clients or even their own form. I think just a little bit of applied knowledge from the textbook that it's based on.
Yeah, I was fortunate. My undergrad was in exercise science, and the whole curriculum was surrounded around the textbook that the CSCS is based off of. So it just felt like I was reviewing things when I took it. But yeah, it wasn't too bad, I don't think. But also, you know, we're coming from 8 years of schooling. So
Yeah. So yeah, let's jump into it. Like, people may want to know, like, what is the actual like job that you do as like physical therapist? Like, what's kind of like the day-to-day stuff that you are doing with clients?
So my life is weird. I feel like I wear a lot of different hats. And Dom's day is a lot different than mine. But so we own our own, you know, in-person clinic. So we're working with clients in person. So I have some clients that are, you know, powerlifting focused. So we're powerlifting together, and I'm doing their programs, inside the gym that our office works out of. And then I'm also seeing clients for physical therapy. So I might get a runner with knee pain. I might have, even like just a recreational yoga person that does Pilates, and, you know, like for back pain, like I might get that kind of client as well. But I work with all active individuals. I don't really ever see anyone that doesn't exercise. I'll kind of tell them, like, if you don't exercise right now, I might not be the right fit for you. So I'm doing that during the day. And then I have my online clients as well. So I do rehab coaching with them. So it's all over Zoom. And we'll just do some movement screens, talk about their training history, injury history, just really try to understand that person's body in all the ways that I can. And then, you know, I'll try to make rehab and exercise recommendations based on that. So yeah, I can have like a video client, and then like right after an in-person client, and then a personal training client. So it can be but it's so fun. I love it.
Yeah, my day is kind of the opposite. So I used to work with Emily. We used to run our practice together. Now I just see patients here and there, TSG clients here and there. Most of my day is spent at a university where I'm lucky enough to teach. I work in a cadaver lab. I teach anatomy, pathophysiology in a physical therapy program here in Pennsylvania. But it's kind of interesting once we get a little bit more into what online physio looks like and kind of what we do with TSG clients for injury management, because it's unique. It's different than most physio, where obviously we're not putting our hands on patients, and it's all exercise recommendations and screening made through essentially telehealth.
Yeah, so I guess we can jump into that next is maybe a combination of maybe what difference you see as a physio working with powerlifters versus other athletes, and then kind of how that changes when it comes to online dealing with powerlifters.
Yeah, so I think working with athletes online is, especially powerlifters, like it's so much easier sometimes in a way, because like if someone is in powerlifting, they are likely also really tracking their sleep. They're also really aware of their nutrition. They're aware of their stress levels. They're aware of factors that could be leading into like why they developed some kind of injury. Whereas like the general population has, like, they don't care. Like maybe they have a little bit of awareness, but it's not like working with a powerlifter. So like the lifestyle interventions, like I rarely have to worry about with a powerlifting client. Like I feel like I can really just look at their body kind of more mechanically. Like in physical therapy, it's, you know, more known now that we need to take like a biopsychosocial approach to clients. And I feel like I don't have to worry about that quite as much with my powerlifters because they're generally pretty healthy, which is also, I feel like, opposite of the general public's, you know, view of us. But, so it's really nice to just like really hone in on like exercise and like load management and like strategies for that, rather than being like, hey, you should eat protein. Like I don't have to have those same conversations like I do with some of my in-person clients. Anything on that?
Yeah. I mean, like Emily said, there's just some low-hanging fruit that we usually have to address with patients when they come in person. So your standard person that's coming to physical therapy was usually sent there by a doctor, or they have a nagging injury that they're looking for help with. And you have to address a lot of lifestyle factors. Like Emily said, sleep, nutrition, stress. Have you had major life changes? Anything like that? Most of our powerlifters that we've worked with, it's been a unique challenge because they've already addressed most of those things. Some, I mean, it is surprising actually. Some of the elite ones don't think about stuff like that. They just go into a gym and lift as heavy as they can. But with the powerlifters, it's really fun because you get to get really, really deep into their loading and you get to calculate a lot. Hey, we're seeing some big fluctuations around this week. We get to coordinate with coaches. Hey, I think maybe we need more general physical preparedness. I think they're a little bit too specific in their training right now, and I think that's leading to too much tendon load. So it's a unique challenge in that way, but it's something that we're really confident in doing. We don't feel like we're missing out on anything by not putting our hands on the patients because it's just so applied with strength and conditioning.
And it's really nice, like they're generally really motivated, right? Like I don't have to beg them please to do exercises like I do with my in-person athletes. Like, you know, if I have a high schooler, like making him do hip thrusts is so much more challenging than getting a powerlifter to do them twice a week. So it's really fun that way too, because people are always telling me like, I'll do anything you say, just tell me what to do and I'll do it, you know, and I never get that response with my in-person clients. So it's really nice how motivated they are.
That was kind of leading into my next question is like, so you're doing online, and sometimes the downside to online versus in person is like you're not physically there as a coach to guide them. So in case of like PT is like maybe doing the assessments or helping them through the rehab exercises and just making sure they're sticking to it. But you're feeling like when it comes to powerlifters, then they're better at maybe hopping on a video call and doing the assessment as you explain it and being able to stay consistent and maybe explain their pain levels and everything better?
Yeah, I think we originally thought of that being a big gap, like where we're not going to be there with them and we're not going to be able to at least coach them and critique them on these different things. But not to sound like too corny, but it has become a strength for us where now we are so available to these athletes. They'll record sets and they'll send them to us while they're still at the gym. And Emily will give them feedback. Emily will talk to them like, hey, I think maybe we should change it to this. Like if your pain level is at this during hip thrusts, maybe we'll switch to isometric holds on a GHD for today. And so we've become so available and communication has become so fast, even internationally, that for us, we see better outcomes than we do with in-person physio where we're seeing them once a week, maybe once every 2 weeks.
Yeah. And I feel like because the athletes are generally so healthy, like these are movement problems. And, I don't need to be in person with you to see your movement. We have wonderful ways to see movement together. And I actually will forget now. Like it's become so much a part of like how I view injuries and how I see athletes where like if I have them in person, I almost forget to touch them. Like it's just so ingrained in me to have people do the movements themselves. What are they feeling? Like describe those things. It's a little less successful in my average, athlete that I might see in person because powerlifters, like they're just so in tune with their body. Like they know how to explain things most of the time. But yeah, it's funny how when I do work with the students with Dom every once in a while and like they can't even fathom that I don't touch my patients. Like it's such like, it's a different world but I love it. I think it's so successful and I think it should be something that PTs should be able to do.
Yeah, it's definitely interesting that it's similar to like, programming or nutrition, whatever.
Right.
It's like now with internet and technology, things have gotten so much better. We can have things live on Google Sheets. You can use WhatsApp for messaging, audio, video, text. Phone cameras have gotten so much better. And so then you can, as a athlete, reach out to some kind of coach anywhere in the world to be able to get a higher level coach that you may not have access to locally and be able to then use the technology to kind of cover that gap. So it's interesting, the same thing that you can hop on a video call, you can have them film sets, send it to you immediately on WhatsApp or whatever. They can fill out a sheet or whatever. You can see live responses to pain levels, and you can do even FaceTime and watch them actually like set up and everything like that. Right. So it's cool that you can then cover that gap. So again, if someone doesn't have a local physical therapist that they trust, or maybe they're just going to tell them like, don't lift weights or whatever, they can find someone who specifically has experience with lifting or powerlifting and be able to kind of cover that gap. That's pretty cool.
Yeah, it's really nice to like just work with so many clients like all over the world. Like in some ways it makes me sad because like I'll have athletes in, I don't know, Germany or something. And it's like, oh, I went to physio and I got a massage and they said to stop lifting, and like that's their experience in so many different countries. So it's nice that they can just like hop online and meet with me in a couple days, but it's also sad that it's hard for them to find someone that can actually help them in the world of powerlifting locally.
That's probably the most common thing we see it's sports medicine as a whole. Mm-hmm. If somebody is able to walk and go to work and get their work done and go home and eat and go to sleep, then they're meeting the basic needs of life, but they're striving to do more. They're striving to compete in powerlifting at a national or international level. And sometimes that just gets missed in healthcare where providers will kind of say like, I don't understand, just stop doing that. Go run or go walk on the treadmill. And so having somebody that understands the loads of the sport and the importance and the identity that comes with it, I think it really goes a long way.
Yeah. I guess that's one of the downsides to industry. I thought you were also going to say, Emily, that one of the downsides to online coaching, because I like a lot of the aspects to online coaching, but one of the downsides is that you then maybe never meet your client, or maybe like I tell people like, oh, I only see them once a year at like nationals or world tour, then I don't see them rest. Or maybe I have a client for like years and I've never met them in person.
Never met them.
Yeah. So,
yeah, it's funny.
There's pros and cons to everything.
Right.
The next topic I wanted to go into, and kind of you guys were discussing with, Dom being scared of heavy deadlifts, is kind of what do you see as far as the injury rates in powerlifting versus maybe other sports? And then are there any like common areas injuries that occur in powerlifting?
Yeah, so they haven't done a lot of studies recently, but there have been some. We can always link them in the show notes or something if people are interested. But the injury rates are not high compared to other sports. Like we are in a sport where there's no true acceleration and deceleration, right? Like we don't have a lot of like lateral forces that we're dealing with, no jumping, no nothing like that. So like the more, catastrophic injuries I feel like are less than like on a soccer field where something could happen like every game essentially. Somebody could get a concussion or tear their ACL or something. So those type of injuries are not common, but I feel like if we had studies that looked at more of the overuse injuries, maybe we would find it's a little bit more common in powerlifting just from the repetitiveness of the stress, and the body might struggle to handle that based on a lot of different factors. But I feel like overall it's an incredibly safe sport, and the studies show that it's really not more dangerous than any other field sport or anything like that, court sport.
Yeah. I mean, the most common thing that we see with powerlifters is tendon injuries. They just get, especially during peaking, when the loads get higher and higher and their rest gets lower and lower, they just start to get this irritation around certain joints. So we don't typically see traumatic ligament tears or tendon ruptures even. I mean, we have, but that's pretty rare in powerlifting. I wouldn't even say that we see a lot of true acute back injuries, herniations, even like major strains or sprains, anything like that. It's usually attributed to peaking or a macrocycle where the intensity is too high and they have tendon irritation, and then they don't know what to do, because tendon injuries, we work with them all day, every day. Individuals don't know what to do. They think they should take time off and do nothing. And then as soon as they go back to the gym or back to benching or squatting, that pain is still there. And so that's one of the things that I guess we're kind of passionate about because we see so much.
Yeah, I would say like the most common areas would be either like patellar tendon, so in the knee, or the quad tendon in the knee. We see a lot of like bicep tendon issues or like rotator cuff related pain. Those are probably like the big ones. And, we do see a fair amount of low back pain, that's for sure. But I feel like Dom said, it's not, oh, I did this rep and I blew my back out. It's like something that is like slowly developing over time, or something that someone's felt for a long time, and maybe they're just like kind of like, oh, it'll go away, and then it doesn't after a couple months. So I feel like those more acute things with like nerve pain and weakness and like I can't get off my couch, like those happen, but it's not the most common type of low back pain that we see.
Yeah, I feel like people just assume like, oh, you're like lifting maximum amounts of weights, so like, oh, that's going to lead to an injury. But like,
Right.
then they neglect the other variables you said, like lateral movements, acceleration, deceleration, or like contact sports. The fact that someone's going to hit you,
Right.
like I was watching, the USA versus Canada hockey game for Olympics, and the guy got hit with a stick on the US team and he lost two of his teeth. Like, you're not going to get that in powerlifting where you're losing a couple of your teeth. So yeah, from what I've seen, the research like on weightlifting, or maybe if they've done on strength training, is like the injury rates are much lower than like soccer, which is maybe one of the higher ones. And obviously football and stuff, you get like concussions, everything like that. And I've noticed the same thing is like, especially with what I would say like drug tested powerlifters, is more overuse injuries. With the non-tested, you might get like the pec tear, the bicep tear, those kind of things, because the tendons and ligaments don't recover at the same rate. But for us, like in USAPL or IPF and stuff like that, it's usually, like you said, overuse. And like, I know even for myself, when I've done like 4 times a week squatting, like, okay, my elbows start bothering me a little bit from that low bar position. But like, other than that, I'm usually pretty good.
Yeah, it's funny. I was trying to actually think of like all of the like super swollen knees and like the ankle sprains and the ligament tears. And I'm like thinking back and I'm like, none of those people got it from powerlifting. It was because they were playing rugby, or they randomly played basketball, or they walked off a like sidewalk, like something stupid. It's never actually the powerlifting that does them in.
Yeah, it could be for some of our powerlifters, maybe they came from other sports.
Yeah.
And so like, oh, I had this like, nagging injury from softball, or I had this nagging injury from whatever basketball. And then they come into powerlifting. And so now you have to kind of navigate around the previous injury, maybe then rehab it properly. So again, yes, maybe not the fault of powerlifting. And now I'm trying to think of like what injuries I've seen in competitions. And I've seen like some more catastrophic ones. Like I've seen someone like break their forearm for like an equip bench at Bench Worlds. I've seen at one of my competitions, I ran a local meet, someone tore their bicep on deadlift. And then a couple competition where maybe someone like injured their knee, not sure in the moment what the issue was, if it was like an ACL tear or something like that. But like I can only think of like maybe 4 catastrophic injuries across all the competitions I've been to.
Right. Yeah, that's pretty good numbers. I like my chances.
And sometimes the other injuries I've noticed with like my clients or other people is also like maybe when they fail a lift, if the spotters don't get it or if they don't have safeties in place, then the injury becomes from the failure. So like someone does have face savers in for bench press, they miss the bench and then it lands on them and they injure them. So it wasn't the actual like lift itself, it's the system you built around yourself to make it safe.
Yeah, I think like that's important too. Like even the injuries that we do see, like the overuse or even like the times that the low back does fail someone and they end up with a, really massive disc herniation or something like that. I don't think it is powerlifting that is the problem. I think it's decision making that's probably the problem. Like, someone that's educated in powerlifting understands that you shouldn't just like, let's see what I can max today. Like that's not something you should do, but there's still a lot of that out there. Like someone will be training themselves and they'll do, 5-3-1 or something. And then they're like, I feel pretty good today. Let's add 50 kilos and see if I can do it. Like that's the day you're going to get hurt. Right. But it's not like deadlifts were bad. You just made a bad decision. And so we see a lot of that too, especially in people that don't have a coach and they're just kind of doing their own thing. And maybe they don't understand like the load management process as well as they probably should. But you can do the same thing in other sports too, right? Like if I randomly go play basketball today and I've never played basketball, I will probably develop patellar tendon pain. But basketball is not the problem. It's just my decision making. And I feel like sports in general can get a bad rap for those kind of things too.
And you know who doesn't make bad decisions? TSG.
Yeah.
But yeah, I mean, in sports and in life in general, you can always get injured any number of ways. So like I've had lifters like, oh, I was grabbing my kid or I was grabbing these groceries and I hurt my back from that, whatever. Or I remember there was this one UFC fighter, I think it was Tony Ferguson, his name, where he was just walking backstage after like an interview or something like that, and he stepped on like a cable that they had out and he like injured his knee just from that. So like anything can happen.
Anything can happen, right?
We lost a great fight to that wire.
Yeah. So we've discussed that like injury rates are pretty low in powerlifting compared to other sports. Now, if a powerlifter wants to try and like reduce their risk of injury even further, what would you see are some like the go-to areas to go to kind of minimize injury risk?
Oh yeah, I could talk about this one for quite a while. So of course there are like the things that we see in other sports and that are really supported by the research and the data, like your injury history is like the best way to, so don't get injured. But we see that, if you've strained your hamstring when you were younger playing soccer, it's very possible that you're going to have hamstring issues in powerlifting. If you've had low back pain in the past, that makes you more susceptible to continuing having bouts of low back pain. So just the history of pain is really important. So I think just the lesson there is if you've had an injury, even if you didn't get into powerlifting until you were 25, but you tore your ACL when you were 16, like you need to stay on top of those things because we see like really chronic strength imbalances and things like that you might not pick up on until you're at like 80, 85, 90%. So we always try to go super in depth with someone's history because we know it plays such a large role in what the athlete might be dealing with now, as well as what they could be dealing with in the future. So I think always rehabbing things like 100% is going to be so much better than just like being like, it feels pretty good. Like I'll just keep going. Like I think either seeing someone that can tell you if you're 100% good to go is really just crucial so that you can have a long career. Just like rehabbing things 100% is definitely one prevention strategy because we see it so often where someone will have knee pain and then the next year we see them for hip pain on the opposite side and then the next year we see them for back pain on the same side as the knee pain and the knee pain didn't really go away, but they're still just kind of pushing through it.
And when Emily says rehab 100%, she doesn't just mean when pain goes away. It means that you should have an objective measure that you're back to your prior level of fitness. So like if you have a patellar tendon injury, you should strength test one leg versus the other, even if it's just reps to failure on a knee extension machine, one leg versus the other. You have to make sure that strength comes back, or you're going to start rotating or shifting on a squat or leaning on a deadlift or starting to pull with your back because you don't want to use your quads anymore. And people don't pick up on that unless they get objective measures. So that's one of our favorite facets of what we do, is pointing out these things that, oh, you broke your ankle when you played soccer in high school. Let's just do some strength measures and see that everything is okay. And usually there's still a lingering deficit. And usually when we clear those up, their lifting performance gets better just as a result. Pain gets better, lower risk of injury, and they feel more confident on their own 2 feet. So that's when we say, like, previous injury history, make sure it's fully rehabbed, objective measures to show that, not just, well, it doesn't hurt anymore, because it might again.
Yeah, I think that's one of the other things too for like prevention is we are in such a unique sport where it requires symmetry, right? Like, of course it's okay in some situations, like nobody is perfect, but you're going to feel a lot better if you can, distribute the loads of squatting evenly between your hips, evenly between your quads, evenly between your shoulders, and bench. If one side is taking the heaviest aspects of the load more than the other, like it's just possible that side might break down faster. So, it's such a unique sport. Like you don't see that in basketball or anything like that, where you truly need like equal distribution of load between your left and right sides. So yeah, that's something we see a lot, where we'll do some kind of like, I don't know, rotator cuff 10 RM, and people will say like, oh, I had no idea that like I could only do half the weight that I could on my other arm or something, even though, they've never had shoulder pain in the past or something. So I think symmetry is important. It won't be perfect, but it's important to try to get there. Yeah.
You want to talk about GPP?
Sure.
Yeah.
Go for it.
The biggest thing we see is in powerlifting, and it's not within TSG or outside of TSG, it's just kind of uniform in powerlifting. As you get better at squatting, benching, and deadlifting, that becomes like the only focus, where it's just squats, bench, deadlift. There still should be some sort of bro out programming where you're hitting these isolated muscle groups and you're hitting this variability in training. Not just deadlift and then variation of deadlift. I mean, like getting on a hamstring curl or getting on the GHD or doing hip thrusts, something that's truly variable in movement. Because when you are in a competition and you're trying to pull your max and you're turning and twisting, and maybe this is the pull for worlds or for nationals, you're going to use everything you have and you're going to put yourself in a precarious position. If you've loaded yourself with other exercises and in other angles, you're going to be ready for that. If you haven't, something's probably going to go wrong.
Yeah.
Yeah. I mean, I definitely see what you're saying there. And that's, something like, for example, we teach in the mentorship is like maybe after your major competition of the year, or if you can, after every competition, to have something like a off season, or we kind of call it like a transition phase, where then maybe you're pulling back from the competition squat, bench press, and deadlift, either some amount or completely, and then be able to do other exercises with that time. So you can then do lateral work or unilateral work or any twisting of the core, things like that you maybe don't do. And also accessory work, if you want to hit up the back a little bit more, if you want to hit up the hamstring some more, those kind of things to just give the body a break from the normal movements that we do, work those other muscles in different planes and everything like that. And also sometimes powerlifting training can get boring, so that you can be excited to do some other things as well. Would you say it also be important to maybe throw some kind of cardio throughout the year as well, whether it's like high intensity like jumps or sprints, or even low intensity like jogging or riding a bike?
This is funny because Dom has recently gotten into running half marathons. And I was so anti-running for a long time. I think if you're purely just looking at will cardio make you a better powerlifter, maybe not, I don't know. But I think it will certainly improve like your overall tissue health. We see like really great benefits from someone that meets the weekly recommended dose of like, even like low and moderate state cardio, like we know that those people generally have better metabolic health than those that don't. So I think like it can definitely keep you a little bit healthier. It will definitely allow you to tolerate more training, right? Like there's plenty of powerlifters that I see where they might get a 5x3 and that takes them an hour and a half because they need to rest for 10 minutes between each set. So I think just building up that aerobic base can be really beneficial for allowing you to tolerate more training, and not feel so run down from it, not feel like that CNS fatigue that a lot of people will get. I know I personally have felt that because Dom has made me start running once a week. I don't go very far, but I do it for like half an hour. But like my workout times are so much shorter, and I know that I do definitely sleep better. He can probably speak better to the actual literature on it.
Yeah. I mean, Emily, as knowledgeable and wonderful as she is, she also gets hurt from overtraining and is very, very persistent in her training despite her pain and injuries. So she's a textbook powerlifter in that sense. So between competitions or between blocks, I try to get her to run or even just bike, just do something aerobic with me. And it's funny, just in the last couple weeks, I've gotten her to run a couple times. And it's just this disconnect because she'll get up in the morning and she'll be like, I slept really great last night. And
my hip feels pretty good today.
My pain is getting so much better. I don't know why. And so I know that this aerobic component is playing a role because she's getting much more restful sleep. Her nutrition is much better because she's hungrier when she's done. So in two facets, yes, for acute performance, just for the sleep component and for the heart rate variability component, it's really, really good for you. But also, I mean, long-term health, powerlifting, as much as all of our competitors and athletes, we want them to do it into their 80s. We want masters 4s for everybody. But at the same time, you have to look out for your long-term health. You're going to be more likely to have a traumatic injury if you're not also taking care of your heart and brain and your sleep.
Yeah, I know sometimes I have my clients be like, well, my doctor told me I should do some kind of cardio because, they might be already like in their 40s, 50s, or 60s, and all they're doing is lifting 3 or 4 times a week. So the doctor's like, hey, could you please do some steady state cardio? So then they come to me and they're like, hey, where can I put this in? So I tell them like, okay, hey, based off your training schedule, put them into these days to kind of get some in. And so like you said, I think it might be beneficial for a longer workout to be able to kind of sustain your conditioning through the workout, and then potentially even like between workouts being able to recover in time for 48 hours later to do lower body again, or maybe even 24 hours later being able to do upper body again. Now, for people that maybe want to start implementing like, oh, hey, there's some good idea, let me put some steady state cardio in just to start off easy. Is there any kind of form of steady state cardio you think might be best to work with powerlifting to not maybe overdo the knee joint or any other joints?
I mean, for me, I've seen a lot of popularity around zone 2 training with incline walking. So really not going faster than a 3 to 3.5 mile per hour walk, but getting a pretty steady incline. So maybe like a grade of 10 or 12. Doing that for 20, 30 minutes will get a pretty good increase in your heart rate, but you'll hover around that zone 2, zone 3, which we know is going to be really beneficial for recovery and restful sleep. I love short sprints. I love running. So I don't know. I don't lift as heavy as I used to, so I can't kind of say that that would be beneficial for somebody that's still competing, especially on a national or international stage. But maybe this one can give me something.
Yeah, I think when just looking at someone that, their main goal is powerlifting, I think incline walking is really great. If for some reason that's like too much, like low back load, because that might just make someone like be a little hunched over for a long period of time. Like, bike sprints can be really nice on the bike, like just make it more interesting than just like sitting there biking for half an hour. That can be a good way to get some high intensity work in a short amount of time. And then, we're also there's really no impact with anything like that, but we can still get like that steady state heart rate that we're looking for sustained over like 20 to 30 minutes. So I think those are probably like the most powerlifting healthy versions. Yeah, sprinting might get people into some trouble if they haven't done that in quite a while. And like running is a skill in of itself, right? That can load up the knees and the hips pretty quickly if it's something someone's not used to. But, graded exposure is great for that too. Because like I'm just not a biker it's just really tough mentally. I just get bored and I don't want to do it anymore. But running outside is like something, it's more engaging. I'm looking at different stuff and it's more fun. But yeah, I definitely had to like slowly work my way up. It was pretty embarrassing to only do like a half mile the first time.
I think she's being kind of generous, even saying a half mile for being on.
I mean, I know exactly what you're talking about, but also I think then that's the benefit is that you can like ease into it with something super easy. So like you said, the zone 2 cardio is like something I was looking into. Like, okay, I have my Apple Watch now. Let me try out my zone 2 cardio. And as soon as I started jogging, it went 2, 3, 4, 5, and I'm like, okay, I can't jog. And so like, yeah, just walking quickly, maybe on a slight incline for maybe a lot of powerlifters first getting into it. Like, hey, that's your zone 2, and you can just start doing that and do that even if you want like 2 times a week and lift 4 times a week and just get started with that. You don't have to do anything crazy. Because I've experienced the same thing with some lifters that maybe do a lot of running or jumping or jump roping or whatever plus squatting, then they get like the patellar pain or like quadriceps tendon pain.
Yeah.
The other thing I was going to say too is like it's interesting that like I guess as a person figure out what you enjoy. For me, I didn't mind being on the stationary bike because my mentality was like, oh, I'll just go on my phone and like post my Instagram post or like message my clients or whatever. So I'm like working while I'm like pedaling and like doing my cardio.
Yeah. Yeah. I think that's the most important part is just doing something that you enjoy, you know?
So one, I guess the most important thing is like, don't get injured in the first place. 2, if you do get injured, which is inevitable for all humans in life, is make sure you're completely rehabbing it, recovering it, getting back your proper strength and work capacity and everything like that before you go fully back into training. And then, like you said, the general physical preparedness, whether it's through lifting weights and then maybe throwing in some aerobic training as well. Would you say then there's anything else that you'd like to add to the list?
Oh, yeah. Because, you know, there are so many different factors that can play a role in like why someone gets hurt. Like sleep, and like it's so popular now. Like I hear how important sleep is all the time, but I feel like it's really hard for people to actually like understand the risks that go along with not sleeping that much. Like a lot of the studies on sleep are done in like team settings or like college population because it's really easy to get like a big group of people that are homogenous together. So like they do studies on like if you average like 6 hours of sleep versus someone that, you know, gets an average of like 7.5 or 8, it's like almost double the amount of risk that you'll have to get some kind of injury. So I think like showing those type of papers to your clients can be really important, especially like if they are trying to push themselves to a high level. Like you're going to have a really hard time if you can't recover and you can't get that deep sleep in. And like it's really challenging in daily life. Like very few of us have the luxury of being professional powerlifters and like your whole life is just dedicated to that. Like you're always kind of juggling your job and kids and training 10 hours a week. Like it's a lot. So I think like making that meaningful to clients is really important. And it's easy to do that by showing them like the data is very supportive of like how important sleep is for success in sport. And then the other thing that I guess is like more anecdotally that I see, like I don't really see this like studied a lot, is I have so often like athletes will come to me and they won't know why they got some kind of pain. They feel like it was very random, and then we'll dig through the history a little bit and they're like, well, actually I was on vacation 2 weeks ago and I only worked out once and then I jumped right back into my program and then I got hurt. Like I don't know like the exact physiology as to why that happens, but it feels like whenever there is some kind of break from training, even if it seems like insignificant, like just a couple of days or just like even a week, that seems to be like a prime opportunity for something to pop up. So I think there's probably a little bit more detraining, a little bit more of like motor unit recruitment going down once you've had that period of relaxation where you're not really stressing your body as much as you really would. So I hear that a lot. Like, I was on vacation and then I got hurt. I don't understand. I thought I'd feel really good, like really refreshed, right? But like, it's really nice in TSG. Like we're always tracking like acute to chronic workload ratio. And like, you can really see how different that is if you actually populate, like if someone literally gets no training and then you compare that to the other weeks, you can see how easily that could happen. Also, like sicknesses, like someone will be like, oh, I got a cold, like I didn't train for 4 days and then I just jumped right back into my week 4. It's like, well, we should probably take a little longer. Let's be a little safer with that. So I see that a lot too, where just like very small break can create an opportunity.
What about, since you brought it up and actually like a lot of people are getting sick right now. So a lot of my clients are like, oh, I'm sick right now. Should I train? What about like when they're actually sick? Would you say that's also a high risk area for getting injured?
Yeah. Realistically, we see the same thing across every sport. So powerlifting kind of gets put in a silo sometimes because it looks so different than a field athlete or a basketball player. But we see the same thing. We see additional strain on the body when you're in times of sickness. We see oftentimes less restful sleep when you're sick. And so when you're trying to push the same workload or trying to hit the same numbers as you were when you were healthy and rested, it's going to be just like anything else. Just like if you didn't sleep, just like if you didn't eat, you're not going to be able to handle that workload either in the session where you're going to fail and you're not going to hit the numbers you want, or afterward where your tendons are going to start to be a little bit irritated. And then if you continue to train that way, you're going to have discomfort and miss additional training. So it's just like anything else. It's good to train while sick, do something, stay moving, don't just sit, because then you're going to see that drastic drop in workload. But talking with your coach and talking with those people around you and making sure that you're only working to what you can tolerate, maybe relying really heavily on your RPEs, relying really heavily on, if you have pain, a pain scale, making sure that you're not pushing it too hard during your acute sickness so that you can come back better once it clears.
Yeah, so it sounds like things like, yeah, like sleep, nutrition, hydration, kind of using those factors regardless of what's occurring. If it's because of vacation or because of sickness or whatever like that, then those changes can then lead to the higher risk of injury. So people can kind of use those like fundamentals to be like, okay, in this situation, am I hitting these things or am I not? Which then may indicate whether they should maybe adjust their training. Which, like you said, that's what we like to do is like, yeah, when someone tells me, hey, I'm going on vacation, I like to mark it in our coach dashboard. And sometimes I'll like push training purposely more into that date and then have them like deload during their vacation or whatever, and then come back kind of starting over, like maybe an introductory week and ease into it. Because it's interesting, like you said, you're thinking like, oh, I went on vacation, I got like a week of recovery, I should feel even better afterwards.
I'll hit a PR.
But for some reason, like rarely does anyone feel great and come back and hit a PR. Yeah, usually it's like they come back and it feels like trash or they get injured.
Right.
And maybe just because like a loss of like skill at technique, or like I said, maybe some other underlying issues going on, it just seems to be a recurring issue.
Yeah, definitely.
It's something, I know it's unrelated, but with soccer players, we see the same thing. There's actually a really cool study where, like your typical soccer game, you see guys on the field or girls on the field, and then you see girls or guys on the sidelines. If you look recently at major soccer events, the substitutes are always running, they're active, they have their pennies on, they're getting ready to go in, because studies have shown that on game day, when the substitutes don't move, they're just sitting there. When they go back to practice the next week, their fitness is lower, they are more likely to get injured. So the same exact concept carries forward in powerlifting. Even if you're on a vacation, even if you're sick or doing something, you want to maintain some sort of workload, because when you get that drastic drop and then spike back up, even if it was just to your previous level, the risk of injury is significantly higher.
Interesting. Would you also say, maybe not exactly the other side, but the other extreme would be like after a powerlifting competition where you just maxed out on all 3 lifts and had like this big energy jump, maybe you cut weight into it and took a bunch of caffeine, didn't sleep well, then maybe after a competition could also be like a high risk area?
Yeah.
Oh yeah, I've definitely seen my handful of, what do they call it? Like gym, there's like some kind of name I see the kids call it. Or like they do, they hit whatever they hit in the competition and then they'll like YOLO lift like 3 days later, and then that's when they got hurt. Like after they've probably had a couple of days off and the body's already really stressed out, and then, they get one good night of sleep and then they're like, okay, I'm ready to go. Let's YOLO something. Yeah, I do see that quite a bit where decision making could probably be smarter.
Yeah. So go ahead, Dom.
I was just going to say, to your point, yeah, absolutely. Like we talked about those big drops then coming back up, but the same thing with workload. When you see it go way up, even the way back down, it's still going to carry that injury risk. So even like an undulating periodization program is good, but you want to make sure that it's steady in how you're increasing your workload up to competition, because any big drastic changes up or down, there's a risk.
Yeah, I was just going to add that sometimes we are maybe biased towards, we only saw on Instagram the people that had successful post-meet PRs,
Right.
whatever. And those may be because like the benefit comes from, let's say they maybe had a bunch of more calories and now they're above their weight class.
Right.
Maybe they're using more comfortable, familiar place as far as where they're training. Maybe the equipment's not calibrated. Maybe they're not hitting things to proper standards. So you get these things that benefit you and you hit bigger numbers, but then maybe we're not seeing all the people that tried it and failed lifts or got
And didn't
injured or
have
those kind of
good
things.
time. Yeah. Yeah, I think it's probably true.
Yeah. So I'm fortunate. A lot of my clients are like the opposite mentalities. After meet, they like don't want to train or they don't want to like get programming from me. They're like, oh, I'll just go in the gym and like do my own stuff, like
Do
bicep
whatever.
curls and calf
Yeah.
raises and different like random stuff just to move their body. Or just like, hey, I don't want to do barbells for an entire week, whatever. I'll talk to you next week. So I get that extreme instead.
Yeah, right. That's funny.
What we can go into next is under the same topic, but probably people are listening are like, well, when are they going to talk about things like foam rolling, massaging, saunas, cold bath, like all those kind of things, TENS unit, whatever like that. So if you kind of want to give your general thoughts on like those kind of recovery methods and when they should be used or not used.
Yeah, it's really a quite hotly debated topic. So we are kind of on the one side of the coin where we don't promote it at all, really. In physio, I know like it's really popular to give like the crossball like into the pec and foam rolling your glutes and your IT band. That I'll see athletes that have seen other providers and they'll send me what they were doing, and it's a lot of foam rolling at times. I think if you're using it as like a warm-up strategy or something like that, it's not as successful as something like just getting your heart rate up. Like I think you can do that in 5 minutes a lot more easily than you can foam rolling your entire body for 15 minutes. Like I think it can take a long time, and the benefits that I think athletes think they're getting out of it, they can achieve in easier and different ways. So we don't really recommend it a whole lot. For the recovery aspect, like I think there are a couple reviews that show like it does help with like DOMS and soreness and things like that. But my caveat is like if you're getting excessively sore after your training, like that's a problem. Like we're not having a foam rolling discussion here. We're having like a training discussion here, right? So like if people like it, that's cool. You can definitely do it if you have the time to do it, but it's not something that we're really ever recommending to people.
Yeah, there's two ways that we go about that. One is when we're addressing it with coaches, and one is when we're addressing it with athletes. So with coaches, we say, look, the science doesn't really support it. Like there's nothing that you're going to gain from that you couldn't get from restful sleep, good nutrition, and appropriately planned training. It's just not going to be a substitute. You're not going to get that additional bump that you want from it. If your client or athlete likes it, if you say, hey, stop foam rolling, and they say, well, what do you mean? I feel really good after I foam roll. Let them have it. It's doing more up here than it is for their tissues anyway. So just let them have the comfort and excitement that comes with it. So they feel like they're better prepared for training. If they feel like they're preparing themselves, let them have it. Now for athletes, we have the conversation that's a little bit different where we say, don't add this. Again, if you like doing this, that's fine, but you need to address these things. I don't care about your Normatec boots that you bought for $1,000. I don't care about all of these recovery modalities that you're buying off of every website. You need to sleep. You need to eat. You need to talk to me about your stress. You need to tell me that you're doing these exercises that we've given you for rehab. If you're doing those, you will get better. If you do those and you foam roll, maybe you'll say at the end of the day, well, I got better because I foam rolled. We don't care. That's fine. But we know these big half dozen things are the things that you need to do, not the additional recovery modalities. Unless mentally you feel like that's giving you the edge, then fine. You can keep it mentally.
Yeah, there's like kind of two schools of thought in PT. Like you have the PTs that are giving a lot of massage, a lot of cupping, a lot of dry needling, and then they'll follow it up with foam rolling. And so like the whole session is relaxing, right? And so that can work just because it's relaxing. It's not, there's very little data that I'm aware of showing that those modalities are actually supported in their ability to either like reduce injury risk or improve range of motion for the long term, right? Like we'll see benefits for like 5 minutes, but that's about it. And so there's people that are extremely anti-massage, very anti-cupping, dry needling. And then there's PTs that are just obsessed with it and they think it's the most amazing thing ever because people do get that immediate response of feeling better. But also, I feel like I've had the experience where I'll ask athletes like, oh, like you get dry needling. How long have you been getting that for this injury? And it's like, oh, 4 months, and you're still dealing with it, right? And so in America, like we're very insurance based. It's a little bit different than in some other countries. And so the PT world is exploding because insurance companies don't want to pay for dry needling. They don't want to pay for massage because we know that it is not beneficial for someone's health long term. But still so many people are just obsessed with it. They just love it. And I think it's just because it's nice to think like, this person is helping me, right? Like it's hard to accept as a PT that like I physically cannot do a lot. It's the person, like I have to show them what they need to do to make themselves better. And so I think that's hard for some people to accept, like in our world where we think we can really just like heal someone with our hands. And that's really just not the case, unfortunately.
Yeah, I think maybe an aspect too of it as well is like some of the stuff you visually see. So like when you see like some kind of elite athlete that has the marks from the cupping or has the KT tape or whatever on them, whatever, like, oh man, they're serious about their training or the recovery, whatever it is going to help them. And so then I'm going to do the same thing and I'm going to tape my shoulder or whatever. So part of that, I guess, it comes into effect. So I was trying to like maybe try and categorize some of these recovery methods. So, okay, we can have like maybe a category that's easier to do by yourself at home, like foam rolling, massage gun, static stretching, those kind of things. Then you have the other side, which you mentioned, which is like things you may have to go to someone to get like a deep tissue massage, dry needling, cupping, things like that. Now, while those may not be beneficial, would you say that those can be like have a downside to doing them like around training? Like could they have a negative effect doing it before like a heavy workout?
Yeah. I mean, when we're looking at either one of those, so when we're looking at foam rolling in particular, if you have any experience with foam rolling, which I'm sure you do, Arian, you're experienced with everything, then foam rolling a really sore muscle, oftentimes it can make it more sore. It can make you kind of feel this like, well, no pain, no gain. Like I'm doing this for my recovery, but it may actually be delaying some of your recovery. The studies that show foam rolling as being beneficial are typically done within like the first 24 hours after training. If you're sore, you have DOMs 48, 72 hours later, and you're still foam rolling, you may actually be inducing additional trauma to the muscle and delaying your soreness even longer, which is going to continue to hinder your training. So there's that side of it when people are really pushing themselves with massage guns and foam rolling where they feel like they have to be hurting. And that's just not true. We see recovery, especially on our end, is kind of the opposite. There's a tolerance to pain. There's somewhere that we want you to be, this sweet spot on the pain scale where we want to live. And if you're hitting yourself with a massage gun that we know isn't really doing that much, but you feel like the pain might be helping you recover, you're actually delaying your progress. The other aspect is like deep tissue massage, going to somebody in person. The biggest gains we see from that are from relaxation. Individuals aren't stressed. It's a passive time. I'm sitting there. I don't have to think about anything. This person working on me is helping my body. In a sense, that might be true. But if you give away too much of your locus of control, if you're saying, well, I have to see my massage therapist after heavy training day, you're going to feel stressed when you're in competition weeks, when you're traveling, when you're peaking, or maybe your massage therapist is on vacation. That's going to give you this additional layer of anxiety saying, well, I'm not going to be able to recover this week. My massage therapist isn't around. And that will hinder some of your training and give you additional anxiety when you get into heavier weights. So keeping that locus of control within, that recovery is active, not passive. I don't need a foam rolling device. I don't need someone to rub my back. Then it's going to let you have better autonomy in your training, more trust with your coach that they listen to you, and ultimately better outcomes.
Yeah, and I have had a handful of people that have gotten massages during peak week because they think they should be doing that, right? They think it's something they should do. And they actually felt worse after. So I think, if you're someone that loves it, that's great that you should totally do it. It's fun, right? But I think at the same time, you have to be mindful of like when you're choosing to do that. Like if you haven't gotten a massage in 2 years and then you get one 2 days out, that might not be the time to try something new, right? Also, I think like if you think about what powerlifting is, like you are trying to exert yourself to the maximum ability in your body. Like you need your motor units to all be firing at the same time. You need your nervous system to be very excitable, right? Like you don't truly want to be like too relaxed. Otherwise it's going to be really hard to ramp your nervous system back up. So sometimes like if I have athletes that will ask me, like, should I get a massage before I compete? And I tell them like, sure, if that's something you want to do, but I would not be doing it 2 or 3 days out. I would do it like 5 days out, 6 days out, something like that.
And my only piece of advice with foam rolling, with massage guns, any of that is if you're going to do it, if you swear by it, you feel like it helps you, that's fine. Put the phone away, turn the TV off, do it somewhere private, quiet, have your cat or dog rolling around, that's fine. But it needs to be something that relaxes you, because the ultimate gains we see from that are from individuals tuning out stressors, whether it's social media, whether it's news, anything, and just focusing on relaxing. If you do it that way, you'll actually see some benefit. But if you're scrolling Instagram while hitting your chest with a massage gun, you're actually doing yourself a disservice. You're just stressing yourself out.
That's a interesting recommendation and interesting thoughts from you, Emily, as far as like massage, because I believe it's the same thing Susie Hartwood Gary used to tell our national team members, because she's also like a masseuse part-time. And so she would tell people like, hey, if it's something you normally do and you know how your body responds to it, then sure, you can continue to do it. But if you don't normally do it, don't wait until the week going into World Championships. Like, oh, I'm going to go get a deep tissue massage, so I'm like extra recovered, or after your flight over there or whatever, and you don't know how you're going to respond to it. And now as well at a lot of the IPF World Championships, I don't know what company they're working with, but they have sometimes some chiropractors or some masseuses from like a certain company that travel around and they come to these competitions and work with people. And so like I'll go because I'm like a coach or referee and I'm like tired from lifting weights in the warm-up room. Like, hey, could you maybe like adjust my back or like massage a little bit so my lower back feels better? But as far as a lifter, I'll like be careful about a lifter, like going to get like a chiropractor adjustment like before you compete or something like that.
Yeah. Yeah, just like anything else, you want to trial things before doing it before something that's really important.
Yeah. And then Dom, you gave your recommendation, but I'll ask for another recommendation when you said that like sometimes foam rolling and these things can be like detrimental as part of your warm up. Would you say it could sometimes in certain scenarios, depending obviously what the injury is, then be detrimental that like, hey, maybe like tweak my groin, it feels weird, so I'm just going to foam roll it like an hour a day every single day to try and recover it faster?
Yeah, absolutely. Like we always tell athletes, if you think of a typical strain, as weird as the image is, you can think of the muscle fibers as separating a little bit, maybe not interlocking the way they should. If you're pressing that foam roller into it, or you're stretching your groin to get the foam roller to the tissue that you want to hit, you're pulling on that more and more and more. We want those tissues to approximate so that you can heal and start to generate force again. So we always tell patients, one of our favorite things is stop picking the scab. People always love like, well, it still hurts when I poke it, so I'm going to keep
poking it.
I'm going to poke it all day. And we say, you're picking the scab. Like it's not going to heal because you just keep picking at it. You keep pushing on it. So it's going to keep irritating it. Let it heal. We'll give it some light loading and it will get better a lot faster than it would have with you pushing into it.
When it comes to the light loading, do you have like a general recommendation as far as like pain levels and the type of pains that is okay versus not okay?
Yeah, generally like the rule of thumb is like 3 to 4 out of 10 is usually like the maximum pain that you want to be feeling when you're doing some kind of movement or exercise. But sometimes that's really hard for people because, powerlifters will say, well, I have a high pain tolerance. So like, I don't know what that means, right? So we heard this the other day and it actually has stuck with me where now I'm telling patients make it bearable, not terrible. And I think that can be easier for people to think about and feel whenever they're actually doing something. Because pain doesn't always mean that like damage is happening, right? Like I'll give people the idea of like a paper cut. Like I can like barely see it, but I know how much it hurts, right? Like, so the pain response is varied and from person to person, tissue to tissue, right? Like just because you feel a lot of pain while you're doing something doesn't necessarily mean it's bad. And on the flip side of the coin, like you don't always want to be feeling high levels of pain and use that as an excuse either. Right. So I think just being mindful that a little bit of pain is okay in most cases. And sometimes it's even good depending on what the injury is. So yeah, like bearable, not terrible is our new favorite slogan.
I like that the bearable, not terrible, and the picking the scab analogy, because everyone understands that like, hey, when you have to cut a scab, you just want to keep going and bothering it, but you need to leave it alone and let it heal on its own.
Right.
Like the body naturally does a really great job.
It will do it. Right.
The other thing I wanted to discuss is, let's say someone wants to work with you. Someone's a powerlifting athlete. Maybe they have some kind of injury. They want to work with you. And you mentioned that, you work with TSG and TSG clients, but some people maybe take that as like, oh, I have to be like a TSG client under programming or whatever to then get the rehab services. So if you want to just talk about like what services you provide specifically through TSG and like what clients can reach out to you and how they can reach out to you.
Yeah. So, I would say actually like the majority of my clients at this point are not TSG athletes. I've worked with plenty of other coaches from plenty of different countries. And it's really fun. It's really nice getting to see like the different sides to powerlifting. But it's, what was the question?
So we can see anybody from anywhere. So while we started with TSG and while our services are through TSG and the team, that's just basically our host platform. TSG and Jason, that doesn't restrict us from seeing other athletes. We have a lot that reach out. They'll schedule through Debbie. They'll schedule through TSG, but we meet a lot of new coaches and we meet a lot of new athletes. And, it really isn't just TSG. It's for everybody.
Yeah. And sorry, my brain stopped working. So whenever someone signs up with us, there's a couple different avenues that they can go down, right? Like not everyone speaks English. And so sometimes we are just providing like messaging support and I'll ask for videos of certain movements or videos of training and I'll try to make recommendations that way. Cause like we kind of discussed before, like if you're in a country where powerlifting is not even understood and you're trying to get help with it, you might have to look for some kind of avenue like us. And we try to do our best to like help everyone that we can because we don't want someone to feel like they don't have access to some kind of supportive team that can help them with their issues. So we've been creative, but if you do speak English, like the typical way is we can either meet as like a one-off appointment. And so sometimes we'll just meet on Zoom and I'll have other coaches join the appointment as well. So that's been really nice because we can get like the full, teamwork approach where I can hear from the coach, like things that maybe they've been picking up on. But if not, like we'll just meet with the athlete over Zoom. It usually takes an hour, sometimes a little bit longer if it's like a more long-standing injury where I'm asking tons of questions and then like the low back, there's a lot of things, a lot of joints that I want to look at when thinking about that. So sometimes it'll take longer, but I think it's really great because in the traditional medical setting, you might not see a doctor for like maybe 10 minutes if you're lucky, so I think just having someone that can take the time to really talk to you about everything, look at like every kind of movement possible without like I don't ever pressure someone like, oh, I've got a patient in 10 minutes, like come on, like keep talking. So I think it's really nice to give someone an outlet where there's no time limit. we're just going to try to work together and figure it out. And so I'll sometimes just meet with someone for one appointment. Sometimes if it's like a more chronic thing, they've had pain for 2 years or something like that, maybe we're doing more like weekly check-ins together. So there's options for that as well. And then I also do like a little bit of coaching. If like someone doesn't have a coach or something, I'll try to help them learn to structure, their training a little bit better as well. So yeah, those are like the main avenues, but anyone can sign up. You don't have to be TSG, and you can just either go on the website and sign up through there. If you have any questions, you can always email us, rehab@thestrengthguys. I'm always super responsive on there. So any questions someone has about what this looks like, I'm more than happy to answer them.
Is that the easiest way for someone to contact you? Will be email rather than like Instagram or something else?
Yeah, Instagram, you might get stuck in their requests if I don't look in there too often. So email, I will definitely see it.
Yeah. So we can throw the email then in the show notes, and obviously the link to our website. So like someone does the single appointment, let's say, and they hop on a Zoom call with you, they go through all the tests, everything like that. Afterwards, what are they receiving as far as like guidelines going forward?
Yeah, so they'll get a really nice PDF that can be quite long sometimes, because we always try to put in like some kind of summary of like what we talked about during the call together, because like it happens so often. Like we'll go through the movements and I'll say, okay, you're dealing with some patellar tendon pain. We're going to use these isometrics, blah, blah. And then at the end of the call, I'll be like, so why are we doing this? And it completely went over their heads. They have no idea. So I like giving someone something that they can refer back to try to show them how important it is. Like we're doing these things for a reason. It's not just by chance. And that makes people more likely to do it as well, because some of the like tendon exercises or some of the rehab exercises are not as fun as squat, bench, and deadlift. So I think making it meaningful to them is really important. So we'll always provide some kind of summary as to like what we found during the call, why we're doing what we're doing. And then you'll get the full recommendations for like your warm-ups, if that's something we want to change, sets and reps for those kind of exercises. I have an almost full video library of all of the exercises that I like to give, because there's a lot of little cues that are really important, like someone just like hanging out doing a side plank and someone that's cueing themselves to do a side plank a certain way. Like that experience is going to be very different. So you'll have a full like video library to refer to as well with the movements that I want you to do. And then of course, like training recommendations, I'll always talk to the coach if that's something that's needed for the injury. So it'll be a nice document that you can always look back to.
Yeah, that's what I like, because obviously I have experience with it with some of my clients and with myself when I went with you guys. Is like, yes, like at the top is like the diagnosis. Then below that, you might have like recommendations of what exercise to do before you start your lifting or maybe afterwards as far as accessory work. And then also we have maybe recommendations on how to change the programming for whichever main lift is affected and how to like progress back. So like, okay, keep RPEs below this, or hey, progress your leg extensions like this to kind of build it back up. So you get like every single section to kind of understand what's going on. Because a lot of people first, always when they're dealing with pain or an injury, is like they want to know what it is. Like, I just want to know what the injury is or what's going on. And then below that is like the solution of how to get back to normal.
Yeah, definitely. It's definitely, I think, the most important aspect of my job. But it does make me mad when people don't read it too. Yeah. So if you're going to work with me, you better read it, because I put a lot of time into it.
The other thing I was going to ask you, maybe putting you a little bit on the spot right now, since you mentioned like the side planks and stuff like that, is now there's no one exercise end all be all that can like cover every single person, every single scenario. But in general, for like powerlifters, are you seeing like anything that's maybe a common weakness that maybe if they did some kind of prehab exercise, maybe for most people reduce injuries or something like that?
Oh yeah, that's really tough. We do give side planks a lot. Like athletes don't load themselves laterally very well. Like I'll see so often, like a lot of coaches give like Cossack squats and like lateral lunges, like single leg RDLs. Like I see like the intention is there, but I think sometimes that's the issue with online coaching. Like you're not seeing these person's accessories for the most part. And so whenever we give an exercise that really isolates out like that glute med muscle or like the lateral hip stability, athletes will not do very well with it, even though they've been doing these exercises where they feel like they're loading that area very well. So it's an exercise that we give really commonly to a lot of athletes, and I have a lot of success with like hip pain or low back pain from it, just by getting like a really isolated exercise that you can't really mess up. Like you can like a single leg RDL, like you can get kind of sloppy with something like that pretty easily. So I don't know. I'm like super passionate about that exercise for some reason. It's super basic. Like it's not anything super crazy, you know, you don't have to like breathe into your 12th rib while you're doing it. So we give those a lot. And then I would also say like thoracic mobility is super important, especially like in America where a lot of us are just on our computers all day long and we're in this really like flexed position. And then we're getting into our bench press arch, which is really extended, or our low bar position, which requires a lot of extension. So we give a lot of thoracic rotation and extension mobility as well. And that seems to help a lot of athletes.
You want me to add? Yeah, I could go all day with these. Definitely thoracic mobility. We give a lot of arcs, sometimes active against the wall, sometimes a little bit more passive on the floor. The side plank that Emily mentioned, we actually manipulated a lot. So we'll load it in a normal side plank, and then to progress it, we'll have somebody raise and lower the top leg, maybe while doing it against the wall. For tendinopathies, rotator cuff injuries, we'll have them side plank and do external rotations with the top arm. So they're getting closed chain loading on the bottom arm, open chain on the top arm. We love for patellar and quad tendinopathies, Spanish squats as an accessory to a squat. We really, really enjoy those tempo. And then for a lot of the low back pathologies we see, individuals might become a little bit more reliant on their back muscles or their hamstrings. So we love hip thrusts. We really, really see a lot of success with those, especially if we feel like the pain is coming from the sacroiliac joint down at the bottom. It tends to be really, really successful.
That's hoping the exercise you would say is the one you gave to me, which you end up saying, which is the side plank with the leg raise, is like, you gave that to me and then like started seeing like, other of my clients doing it when they worked with you all, and then just seeing it like, you know, on the YouTube channel. So obviously you're giving it out a lot. And I'm like, I wonder if that's like a common thing. And it makes sense. You're saying like, as humans these days, we sit around a lot. And so maybe our hips get tight, maybe our glutes get tight, maybe we're not using them as much, depending what exercise we're doing. So they're a little bit weaker. And so, yeah. And then you said the whole lateral aspect when it comes to powerlifting, we don't maybe train that as much. So when I did the side planks with the leg raise, I'm like, oh, this is a challenge. And then also I think maybe my left side was like much more difficult than my right side. So I had more of like an imbalance there on my non-dominant versus the dominant side. So I was like, oh, that's interesting, the exercise. And then I guess it is something you commonly give because maybe across all powerlifters, they have like, you know, similar weaknesses that I would have as a powerlifter.
Yeah. Yeah, it's super common. I don't know like the exact reason, but I feel like I'm never really blown away by someone's side plank strength, even like in these lifters that are winning world championships, you know.
It's humbling.
Yeah, it's humbling.
Yeah, definitely. It's a interesting, just, using your body weight and just going up a little bit. And I'm like, oh, well, raising the leg should be easy. It's just lifting your leg against gravity or whatever. And I'm like, oh man, it's really starting to burn.
Right.
So as we finish off the podcast, is there any like, you know, final words you want to give as far as physical therapy or injuries or whatever to everyone listening?
Ooh, that's like a big...
Yeah, you know, just any thoughts of maybe, you know, you can give us some thoughts on, you know, in how, you know, injuries happen, you know.
Yeah, I think what I want to say would just be like, it's totally okay to like have pain in powerlifting. Like that is it's very normal. Like not to say that it's not important or not something that you should care about, but I think like a lot of people will have one or two injuries and just think like, this isn't for me, you know, like I shouldn't do this anymore because I'm not good at it. I keep getting hurt, etc. But that's not the case. Like being in pain is part of being a human. You know, I think it's empowering to think like I have this pain because I'm trying to make myself better. I'm trying to push my own limits, and there's a little bit of risk with that, and pain will pop up, but it will also get better, and then I'll get back to training. And so I think it's something that brings a lot of athletes down. And if you can just frame your mindset a little bit differently and view it as a learning experience, and you're going to be better off when you're through it, is a lot better than just thinking the world is ending and the sky is falling and I shouldn't powerlift anymore. So I think that's another fun part of my job where like I get on a call with someone and like sometimes they start crying. Like it's the most important thing in their life and they can't do it anymore. And like to show them that they are still capable and things are going to be okay. And they're going to, go to the gym tomorrow with just a couple little tweaks. Like I think empowering people to stay in the gym is really fun and like the best part of my job.
Yeah. 100%. I think powerlifting becomes an identity for a lot of people, rightfully so. Whether you're good or bad at it, there's a lot of pride that comes with doing something where you truly push yourself to max effort, and getting injured can be looked at like, well, I'm a failure. I failed at this. I don't know how to coach myself, or my coach doesn't know how to coach me. And there's just so many factors that go into it that it's not a mark of failure. And with that, it's an opportunity for growth to try new exercises and not just rest. We see a lot of athletes get injured, and that's either the end of their powerlifting career, or they can't shake the pain because they just feel like, I don't know what to do. So I'm going to rest. I'm going to sit. I'm going to do nothing. I'll go back into the gym next week or 2 weeks from now and get under the bar. And when the pain's not there, it becomes a mental load on them. They get stressed. They get anxious. They stop getting coaching. It's not a mark of failure. Just communicate with your coaches, no matter who they are, communicate with yourself. And if you can't figure it out yourself, don't let it weigh down on you too much. Communicate with a rehab professional that understands what the loads of powerlifting are like, because like we touched on already, the healthcare system can overlook athletes. Sports medicine is what it is because it is really specific. Most individuals don't understand the pride and joy that comes from pushing yourself really hard. And they say like, just don't do that if it hurts. So working with somebody that understands who you are as a person and who you are as a powerlifter becomes really important, because we see a lot of people stop lifting too soon, and we see their lives change because they lose a core piece of themselves, and it doesn't have to be like that.
Yeah. I love the answers. I'm going to sneak one more thought out of both you all is, what if someone's listening to this and maybe they thought about going into physical therapy and maybe now they're more interested from hearing from you? Are there any thoughts you want to give to someone who maybe wants to make physical therapy their career?
I'm going first because I work in a university. I train young physical therapists. So I would say powerlifting and physical therapy go hand in hand. So if you're passionate about PT because you're powerlifting or because you train a lot, you're already going into it with a great advantage. You understand levers, you understand how the body works, and you understand the mentality of somebody who gets hurt. Now, physical therapy in just like a zoomed out overview, we love it. It's how I met my wife. It's what gives me joy day to day. The only piece of advice I would give someone if they are getting into this is remember that patients are not fragile and they can be pushed. Physical therapy, we see this from country to country, state to state. It's become a really passive part of people's lives where they show up, they get dry needling, they get cupping, they get taping, massage. It shouldn't be like that. We see far superior outcomes to active rehab, active physical therapy, where somebody maintains that autonomy where, hey, I'm progressing my loads. I'm getting back under the bar. We see way better outcomes than passive, where somebody has to rely on you as a provider to give them those massages and give them that stretch. Keep people empowered, keep them doing what they love, and you'll never have a boring day in your life.
Yeah, I would say my biggest recommendation is, like, if you are listening to this podcast and you're thinking about physical therapy, you probably already exercise. And if you go into PT school, you are already light years ahead of some of your professors, possibly. Like, I remember being so frustrated where we were giving pelvic tucks for like soccer athletes. And I was like, this doesn't make like any sense to me. And I was so frustrated with the profession. So I think just knowing that like there is more out there than what your schooling will give you. And there's so much to learn and there's so much to offer patients and athletes that you might not get with like your initial experiences with PT. So just knowing that there's other avenues out there, you don't have to just be sitting in a clinic seeing 6 patients an hour, like documenting your life away. Like that doesn't have to be an option for you. Like it will suck while you're in school because you have to go through that. But it's such a great profession. And I think we have a really unique way of caring for athletes that you won't get as like an orthopedic surgeon or as like a nurse. Like you will spend more time and get to know your patients better than a lot of other professions out there. So I think it's really special in that way. So if you like connecting with people and you like helping people, I think it's a wonderful avenue to go down.
Thank you. Great message from both of you. And again, thank you very much to both of you for coming on. Even for me, like some things I've already known kind of what answer you're going to give, or maybe I already have some experience working with both of you, but I learned quite a bit as well. So I'm hoping everyone who listened as well learned a lot.
Awesome.
Yeah,
Thanks,
it'd be
Aaron.
super fun. Maybe we'll do one in the future and get really like into injuries or something.
Definitely. And then we can always, go further into different topics on future episodes. And so for everyone who's listening, in the show notes, like we said, we can always throw some information regarding like a study on injury rates of different sports. We can throw your guys' email and our website if they want to contact you to discuss things further, or, hire you for any kind of injuries they're dealing with. And then they can always throw in the comments, obviously you guys can answer specific issues about someone's specific injury, but if anyone has any general ideas or questions you want to throw in there about specific topics or different methods of recovery, whatever like that, they can throw that in there, and then we can always have you maybe answer a couple of them in the comments, but also maybe use those for future episodes, maybe go through and do maybe a little Q&A or go into more specifics of, different injuries when it comes to powerlifting.
For sure.
Yeah, that'd be fun.
Yeah, it's a great idea.
Yep. So again, thank you for coming on. Thank you for everyone for listening. Like the episode, leave your comments, and we'll see you guys next time.
Thank you.
Thanks.